Good morning. Circle Chiropractic knee traction, decompression, synonymous. So don't let anybody tell you that you have bone on bone and it's gone. There's nothing you can do about it except to get a new knee. Here's what you do. Here's how we stimulate the nerve endings that are in your ligaments and cartilage to get the right message, to send a healing incoming information to the brain. The brain says, oh, that's what I need to do, and sends the healing information out to those ligaments. So, well, here's a good comparison. You know that bone density is strengthened when you do weight-bearing exercise. So you're communicating by gravity to your bone cells. They say, oh, that's where we need to strengthen, and that's what the brain does. So in the opposite direction, ligaments and tendons, bones keep you the stress this way, strong. Ligaments and tendons need this kind of message, the nerve endings to fire that go this way. Ligaments, tendons, cartilage, the bony cartilage. So by slowly pulling and releasing and pulling and releasing, you are stimulating that signal. So you won't get totally all the cartilage back, but you will get enough cartilage and function that the knee you have another 30,000 miles left on those knees, okay? Strengthening, healing the ligament and tendon. You're increasing joint fluid, in with the good, out with the bad, by pumping. We'll show you how we monitor. So generally a dozen times doing this pull, and the treatment only takes 7 minutes. So in combination with the chiropractic adjustment to balance the alignment, because that's how you probably got arthritic in your knee. Things were a little bit this way or that way, or stress, or you had trauma. So this works on everything except, okay, the tendon is severed. Yeah, that's got to be sewn back together. Everything else, the Knee on Track is the name of the traction unit. The knee decompression will help you a lot. And you'll know it within the first 6 times of trying it, that it is, most people, they notice it after one session of this. So let's take a look at how this operates. Say if I was going to do my left knee, we stabilize I'm going to do this on a bare knee, so we'll stabilize above. And here's your problem joint right here. Nice, knee. What do you need from us, knee, to do your healing thing? Little pressure. There's a bladder in here that's going to snug up once we get locked in there. Tighten. Traction. Snug here to stabilize. It's really comfortable, actually. And then we hit the, Cameron, if you can grab that thing, we're ready to go. Gently. So there's a sensor in there that feels the amount of pull. We have it set for just 13 pounds of pressure. When it gets there, it just holds for a minute, and then it's going to release. It's so gentle you wouldn't know that anything is happening. That's the important thing, is to talk to the ligament. We don't want to yell at it. we just want to talk by way of this traction, lengthening your nerve endings that sense that tension, fire with just the right amount of pull. This is going to be good because I tweaked it yesterday, and I think, oh, well, I'm going to do my traction tomorrow morning. And then it's going to release. Now it's going from 14, 13, 11, slowly. This slow action is pretty much the secret, the parameter, the timing of why this works so well. And, you know, it's not very dramatic. There's not much for you to look at. This is going to take 7 minutes. And then we measure before and after. You can get a sense of how much better this is, because we're going to have used, here's our very scientific tape measure here. When I touch, just standing, I'm at 12 centimeters, and then I'm gonna bend, and there's where it feels. So we have 21. So we note that amount, and I note the level of pain. Okay, that was about a 3 out of 10 pain. And then when we do this afterward, you'll see the difference. You're going down way further before you feel anything, and what you feel is way less than before. So you got to try this before resorting to any more drastic kind of intervention for the knee. Get the knee to heal itself. Get in touch with us, Circle Chiropractic Center, 703-385-2990. Glad to help.